Students, welcome to another very important topic regarding our practical and viva examinations. So that is history taking. So many a times we do very basic mistakes regarding history taking of any patient. Okay, so we will discuss here in this video in detail about what are the key elements of history taking of various conditions related to ear, and what are the necessary points that we have to ask from the patient that are relevant to any clinical condition. Okay, so let's proceed. Now, coming to the elements of history taking, there are certain important points related to identification of patient. First is name of the patient, what is the age, what is the gender, occupation of patient, place from where he or she belongs, and what is the religion. Why this is important? Because identification of patient is of primal importance, and there are certain diseases which are more common in particular age group, or they have a gender predisposition, such as nasopharyngeal angiofibroma. It is a disease more common in adolescent age group, and it has exclusively male predisposition. Okay, also such as noise induced hearing loss. So this is a condition which is related to the occupation of patient. Okay, so that is the important part to ask from any patient. Next is chief complaints. Now coming to chief complaints, two points which are important and that we have to keep them in our mind, that chief complaint should always be in the patient's own words. Okay, we do not have to manipulate it, and it should be in a chronological order. Means the oldest complaint will be written at first or at the top, and the latest or most recent complaint will be placed at last. So the chief complaints will always be in patient's own words, and it will be in a chronological order. Next is the history of present illness, that is also known as HOPI in abbreviation. So that is history of presenting illness. In this, we basically have to elaborate the chief complaints under various headers. Okay. Next is family history, then comes past history, and then personal history. After that, we proceed to the examination part. Now, coming to the examination, it can be again divided into two parts: systemic examination and local examination. In the systemic examination, we examine basically various systems of the body, such as cardiovascular system, respiratory system, for breath sounds. And in cardiovascular system, we look for the normal heart sound, and if there is any added sound is also present or not. And we see for the gastrointestinal system, okay, we also examine guarding and all other things. And we also examine the neurological system like muscle tone, power, and various other things. Now, important for ENT perspective is our local examination, that is examination of ear, nose, or throat, or larynx. Now coming to the again history taking part, that is our topic for this video. So basically, what are the chief complaints related to the ear? Okay, so in today's topic we are basically focusing on ear. So what are the chief complaints related to ear? Most commonly it will be ear discharge, reduced hearing, or it can also be written as hard of hearing, and ear pain. It can be ringing sensation or tinnitus, and dizziness, also many a times called as vertigo by the patient, although vertigo is a diagnosis. And it can also be headache. So these are the few important chief complaints related to the ear. Okay, now coming to the history of present illness. So under history of present illness, basically we ask from the patient few more questions, that from which we can elaborate further the chief complaint, and we can gain more information regarding the disease. Okay, so we will discuss each of the chief complaint one by one here under various headers. So taking first ear discharge, what question we can ask in case of ear discharge from a patient? What is the onset? It can be sudden or insidious. Then what is the duration? If the duration is less than 3 months, then it will be labeled as acute. If the duration is more than 3 months, it will be labeled as chronic. Okay, what is the amount of the ear discharge? So it is divided into three categories: profuse, moderate, and scanty. So basically, what do we mean by profuse discharge? Basically, profuse ear discharge is when we are unable to clean the ear discharge completely from the external auditory canal, but we can see the tympanic membrane for a while. Why? Because the tympanic membrane is hidden behind the ear discharge. Discharge is so much that it is totally covering the tympanic membrane or the middle ear pathology. We cannot see clearly. That condition is known as profuse ear discharge. What is moderate ear discharge? It takes some time to refill the external auditory canal after the cleaning of ear. Okay, so basically once we will clean the ear, from the ear discharge, we will examine the tympanic membrane and middle ear, and after that, after some time, again the whole of the external auditory canal will be filled with the discharge. So that is known as moderate amount of ear discharge. What is scanty ear discharge? Basically, when patient cleans the ear uh, by himself, he tries to clean the ear, and then while cleaning, he or she notices there is certain amount of discharge that is staining the cleaning swab. Okay, so basically the discharge is noticed by the patient only while ear cleaning. Otherwise, patient has no outside leakage of the discharge. So that condition is known as scanty ear discharge. Now coming to the color of ear discharge. So again, it has divided into various categories. First is colorless. In this, we see mostly the watery ear discharge or serous type of discharge. It is mainly observed in case of CSF leak or CSF otorrhea, we can see, or in case of mucoid discharge, mostly the mucus is colorless. So in that case, the discharge will be colorless. Yellowish or yellowish brown, it can be seen in case of infections, that is where the pus will be present, so it will be labeled as purulent discharge. Greenish color will be due to infection of bacteria, that is pseudomonas. Black color discharge will be due to aspergillus infection. White color discharge will be due to candida infection, that will be cheesy curd like in consistency, and red color will be due to blood in the discharge or staining of the discharge with the blood. So these are the various categories for color of discharge. Now coming to few other properties, such as if there is any kind of foul smell coming from the discharge, most likely it will indicate etechoenteral type of CSOM, that is chronic suppurative otitis media. Why foul smell will be there? Because of the erosion of bone due to cholesteatoma. There are certain lytic enzymes, bone lytic enzymes, that will be released by the cholesteatoma, that will do the lysis of the bone, and because of the lysis of the bone, there will be a foul smell. Also, it can be due to a superadded saprophytic organism infection, bacterial infection in case of tubotympanic disease. Okay, so these two are the important causes of foul smell coming from the discharge. Next is the consistency. Watery consistency will be there. It will be seen in case of CSF otorrhea or in case of early cases of allergy, where the discharge gets aggravated due to allergy. Also, next is the mucoid category of discharge. In this, how we will be differentiating the mucus in the discharge? Basically, the discharge will getting sticked to the ear cleaning probe, and it will be stretched like a thread, like we can stretch a thread from a water. Basically that will indicate the mucoid discharge. It will be seen in case of early stages of CSOM. Next is the mucopurulent discharge. It will be seen in case of tubotympanic CSOM. There will be mucoid component as well, because the goblet cells are present in the middle ear, and there will be infection that will lead to the formation of pus. So combinedly it will be called as mucopurulent. And next is the purulent discharge. It will be seen in case of furunclosis, that is uh, infection of hair follicle in the external auditory canal. Also in cases of malignant otitis externa, and in case of external auditory canal malignancy. Okay. Next is the blood stained ear discharge, or blood coming in form of discharge. That will be seen in case of glomus tumor. Basically, that is a middle ear tumor. Also, in cases of granulation tissue of the middle ear or external auditory canal, if there is any AV malformation, means arteriovenous malformation, or if there is any kind of malignancy is there, then also we can see blood coming from the ear, or the discharge will be blood stained. Now, what are the aggravating and relieving factor of ear discharge? Basically, ear discharge will be aggravated in case of upper respiratory tract infection, or in cases of allergies. When the allergy will be aggravated, then also ear discharge can be aggravated, or it can be aggravated by the accidental entry of water into the ear. And what are the relieving factors? Basically, the topical application of ear drops containing antibiotic or steroid, and also with the help of certain oral medications, the discharge can be relieved. So next chief complaint is or reduced hearing, or also we can write it as hard of hearing. So what things we can ask from the patient regarding this complaint? So we can ask which side is affected more, right side or left side. Again, these headings are the same: onset, duration, and progression. It will be sudden in cases of sudden sensory neural hearing loss, or noise induced hearing loss due to sudden loud noise exposure, that is known as acoustic trauma. Also it can be insidious. There are various other causes in this category, that is impacted wax in the external auditory canal. It can be furunculosis causing obstruction of external auditory canal. It can be keratosis obturans, malignant otitis externa, or there is a bony outgrowth or a bony tumor present in the external auditory canal, that is EAC osteoma. Now coming to the middle ear causes of reduced hearing, it can be serous otitis media, acute suppurative otitis media, chronic suppurative otitis media, or otosclerosis. Coming to the inner ear causes, it can be due to Meniere's disease that we have already discussed. It can be due to noise-induced hearing loss or acoustic trauma. Presbycusis can also be a cause, that is age-related hearing loss, and ototoxicity can also be there due to certain drugs. Next chief complaint is our ear pain or otalgia. Again, we have to ask the same thing: which side is affected, right or left? Onset will be acute or sudden or insidious. What are the causes of sudden ear pain? It can be due to injury to the ear in any form, ear probing by any hard object, or it can be iatrogenic, that is due to any kind of instrumentation. Basically, any accidents such as road traffic accident can also lead to the sudden ear pain. Inflammation in the ear, that is otitis externa, furunculosis, will lead to the severe sudden pain in the ear. Also, it can be due to acute suppurative otitis media and acoustic trauma. So these are the few important causes of acute pain in the ear. Again, coming to the insidious or gradual causes of ear pain or otalgia, it can be serous otitis media, chronic suppurative otitis media, malignancy of external auditory canal, and middle ear. On the basis of duration, it again can be divided into two categories: acute or chronic. Acute is less than 3 months, chronic is more than 3 months. What can be the nature of ear pain? It can be throbbing pain in case of acute suppurative otitis media and furunculosis. It can be dull aching pain in case of serous otitis media. It can be continuous pain in case of furunculosis, otitis externa, or barotrauma, that is due to sudden pressure change. And also in cases of malignancy of external auditory canal and middle ear, there will be a continuous pain that will be present in the ear. What are the aggravating and relieving factors? Basically, ear probing may aggravate the ear pain, and relief will be provided only by the medications. Also, many a times periodicity is seen associated with the ear pain, that is, pain is getting more severe in night. It is mainly seen in cases of acute suppurative otitis media. Why? Because in night there will be more venous congestion. So more venous congestion will lead to the more pain. So these all are the things associated with ear pain. Now coming to the referred otalgia or referred ear pain. Now coming to the referred otalgia, basically what is this? The cause of pain is not inside the ear, it is coming from somewhere else. That is, the pathology is outside the ear, but the pain is getting radiated or referred towards the ear. It can be seen in case of auricular temporal nerve pathology, or in case of any issues with the temporomandibular joint and dental pathology. Also, if auricular branch of vagus nerve is involved, or the first branch of glossopharyngeal nerve, that is tympanic nerve or Jacobson's nerve. Basically, it arises from the inferior ganglion and it provides sensory innervation to the middle ear. Okay, so it also radiates pain towards the ear, and many a times it is seen in cases of pharyngeal and laryngeal pathology or in acute tonsillitis. Also, the pain is getting referred or radiated towards the ear. Uh, in the cases of greater auricular and lesser petrosal nerve involvement, which have the nerve root origin of C1 and C2, it is also seen that referrotalgia will be there. Next chief complaint is ringing sensation or tinnitus inside the ear. It has been divided into two parts. First is objective tinnitus, second is subjective tinnitus. What is objective tinnitus? In which both examiner as well as patient can hear the ringing sound, that is objective tinnitus, and in subjective tinnitus only the patient perceives the ringing sound. What are the causes of objective tinnitus? It can be glomus tumor, that is a middle ear pathology, middle ear tumor. It can be any arteriovenous malformation. It can be palatal myoclonus, or it can be due to patulous eustachian tube or patent eustachian tube. Now, what are the causes of subjective tinnitus? It can be divided into three categories based on external ear causes, middle ear causes, as well as inner ear causes. So, on the basis of external ear, it can be due to furunculosis, impacted wax, or it can be due to EAC, osteoma, or canal exostosis. And due to middle ear causes, there are very important such as ASOM, CSOM, or serous otitis media or otosclerosis. And on the basis of inner ear, the disease can be due to Meniere's disease, labyrinthitis, or acoustic neuroma. So these are the few important causes of ringing sensation inside the ear. Coming to the next chief complaint, that is our dizziness or vertigo, in which the patient has a feeling of imbalance of own self or the surroundings. There are various causes, the innumerable causes of this condition. It cannot be solely categorized into the ENT. So what are the few general causes of the dizziness or vertigo? It can be due to any CNS lesion, that can be motor neuron disease or stroke or cerebellar lesion or Alzheimer's disease. What are the ENT related specific causes of the dizziness or vertigo? It can be due to vestibular neuronitis. Also, BPPV can be there, Meniere's disease in case of superior semicircular canal dehiscence, as well as migraneous vertigo. So these are the few important causes of dizziness or vertigo that patient feels often. And also there is an important chief complaint, that is headache. So headache will be seen in case of complications of chronic suppurative otitis media, or whenever there will be a raised intracranial tension, then the headache will be there. So that's all about the history taking of ear. I think we have covered all the important points related to the history taking of ear. In the next upcoming video, we will discuss the examination of ear. We will examine the external ear, middle ear, and inner ear. Stay tuned with this channel for more such educational contents, and please like, share, and subscribe. Thank you.